Okay, today I'm going to talk about the effects of toxins, chemicals, and mutations on voltage-gated sodium channel, how it affects the channel. The first I want to talk about toxins. Tetrodotoxin, this is derived from Japanese pufferfish. These toxins block the voltage-gated sodium channels. Now, it actually blocks the ionic passageway, and by blocking this, it actually inhibits the generation of action potential. Okay, and that causes paralysis of the skeletal muscles. Saxitoxins, it is derived from or it is found in dinoflagellates. It also performs the same functions by the same way. And muconotoxin, it is derived from fish-eating cone cells. It also blocks and perform the same function. Now, the fourth toxin that I have mentioned here, batrachotoxin, it is derived from arrow poison frog, and this toxin actually works differently. It actually prevents the closure of the voltage-gated sodium channel, and by preventing the closure of this channel, it actually paralyzes the skeletal muscle. So it performs the same function, but activity is different. Now, I want to mention, to understand this point, you have to understand the this cyclical changes. That is, this channel actually go through three conformational changes cyclically. At first, it remains closed during the resting potential or resting phase of the neurons. That means in an unexcited neuron, when the membrane potential is at minus 70 millivolt, all the voltage-gated sodium channels remain closed. Now, when depolarization occurs, that means when the membrane potential of the neuron increases from minus 70 millivolt, and when it reaches approximate minus 40 millivolt, all the voltage-gated sodium channels actually open, and it opens very quickly, less than 0.1 millisecond. And then the voltage-gated sodium channels become inactive within 0.5 to 1 milliseconds, and then it closes. Now, from inactivations and reopening of the same channel, it takes approximate 4 milliseconds. That is called the refractory period. Now, why I am talking about this? Because this poison, batrachotoxin, prevent the closure. That means these channels remain open. And now, if the voltage-gated sodium channels remain open for a longer period of time, what will happen? It prolongs the action potential, and it also prevents the generation of another action potential, a subsequent action potential. And we know the frequency of action potential is the language of nerve. So if the action potential prolongs, and if there is no action potential occurs in the skeletal muscle, what will happen? Spasm will occur, and it also paralyzes the skeletal muscle. So by doing, or the mechanism of the action of batrachotoxin is different. It prevents closure. That means this channel remains open for a longer time, but it also paralyzes the skeletal muscles. Now, alpha toxin, it is derived from scorpion. This affects the channel by slow inactivations. That what does it mean? We have actually, I have mentioned that inactivation occurs within 0.5 to 1 millisecond. Now, if it becomes slow, or the inactivation process becomes slow, what will happen? It also prolongs the action potential. And if action potential is prolonged, what will happen? Paralysis will occur, and cardiac arrhythmias can occur. Next is beta toxin. It is also found in scorpion. Then this toxin actually performs differently. The mechanism of action is different. Here it shifts the voltage dependence of voltage-gated sodium channels. Now, the name voltage-gated sodium channel means it depends on the voltage. I have mentioned in my previous video that the structure of the voltage-gated sodium channel is such that it can sense the voltage. So this toxin, when bind with the voltage-gated sodium channel, it shifts the voltage dependence. Now, as I have mentioned, at minus 40 millivolt, all the voltage-gated sodium channels get opened. But when these beta toxins bind with the voltage-gated sodium channels, what happens? It lowers the activation threshold. See, this is the threshold level. At approximately minus 40 millivolt, all the voltage-gated channels open. But if these toxins bind, it lowers the activation threshold. That means at minus 30, minus 35, or less than minus 40 millivolt, these channels can open. These voltage-gated sodium channels can open. And if the voltage-gated sodium channels opens at the lower membrane potential, what will happen? Uncontrolled action potential will occur. That means action potential firing occur. And that is manifested as a physiologically as nerve overexcitation and pain. Okay, now the last point I want to mention here, the chemicals like lidocaine and procaine, these are the local anesthetics. It also blocks the passageway of the ions, and it prevents the action potential generation and by preventing it, prevent the perception of pain. Now, I want to mention some mutations that occur in the voltage-gated sodium channel and their effects in the physiology. I have taken one example like voltage-gated sodium channel 1.5 that are actually present in the cardiac muscles. The gene is called SCN, means sodium channel 5A, and it causes long QT syndrome. Now, QT actually indicates the duration of the depolarization and repolarization in the ventricles of the heart. Now, when the duration increases, we call it long QT syndrome. What happens most of the time, the mutant channel open and close normally, but occasionally they fail to inactivate. And I have mentioned earlier that if the channel fails to inactivate, what will happen? It prolongs the action potential, because more longer the period, the channels actually remain open, and that causes the prolonged action potentials. Okay, and it causes abnormal cardiac rhythms or arrhythmias and sudden death. Another mutation that can occur in the voltage-gated sodium channel, that is voltage-gated sodium channel 1.1, and it causes generalized epilepsy with febrile seizures, in short we call GEFS, and it is due to the neuronal hyperexcitability. And this neuronal hyperexcitability occurs due to two reasons mainly. First is slowing the inactivation of the voltage-gated sodium channels, as I have mentioned earlier, and it causes the prolonged action potential. And the second is lowering activation threshold, and it causes uncontrolled action potential firing. Now, the reason why this lowering of activation threshold occurs is due to the decreasing the ratio of inhibitory to excitatory inputs onto neurons. So neurons can actually take input from inhibitory neurons or excitatory neurons. Now, the summations or the ratio actually indicates when this membrane potential or at what membrane potential this voltage-gated sodium channels will open. Now, by decreasing the ratio of inhibitory to excitatory inputs, the activation threshold actually lowers, so the neurons actually fires or action potential firing occur at lower membrane potential, and that causes the neuronal hyperexcitability. Another example of mutations that can occur in voltage-gated sodium channel 1.7, that humans feel no pain.